So I'm here talking to Dr. Paul Anderson, and we have the 7th International AAMP conference coming up in Scottsdale in May. Dr. Anderson, welcome, and please tell me how things are going in preparation for this conference.
Well, we're very excited about Scottsdale with our focus on chronic gastrointestinal illnesses and their treatments. And we have all of our faculty lined up. We have our agenda finalized, and we have everything ready to go.
Well, that's good to hear. Now, tell me a little bit about we know the theme, but you know more on the topics now and the speakers
Yes.
you've selected. Let's get some background on those.
So one of the things we try and do with AAMP is to get the best speakers we can in the topic area, and so we will set a overall topic such as chronic gastrointestinal disease, but that we will not set the specific topics until we see who the speakers are in their specialty areas. So what we're excited about is that we have three distinct but overlapping areas of content. So the first portion will be chronic inflammatory disease in the GI tract. So inflammatory bowel disease, Crohn's disease, ulcerative colitis, etc. And we'll talk about not only modern diagnostics, but how to manage those patients. In the middle of the conference, we have a long and very deep section, but it has a beginning, middle, and end, which is very important, on dysfunctional overgrowth syndrome, so SIBO and SIFO. And we have some literal world-class speakers coming to talk on those subjects. And rather than having a number of different speakers talking about different aspects, what we have done is we put together a curriculum that lets you begin with how to identify the patient, how to test them, and then the best ways to treat them. And so we have probably the most comprehensive training on overgrowth syndromes in the middle. And then the final portion, we will be talking about immunologic dysfunctions in two parts. One would be autoimmune and allergic, and the other would be cancer of the digestive tract. So all about digestive tract, but we have the beginning on the inflammatory processes, the middle on the overgrowth and functional processes, and then the final on the immunologic processes, which include cancer.
That's great. And now you have educational credits available. You have a range of credits.
Yes.
Tell me
So
about those.
one of the things that we've worked very hard to do is to have ACCME accreditation, which is AMA Category 1 PRA credits. And we have sub-credits that include pharmacology, and we also have some ethics credits as well, which you can find on the website. We also have a co-sponsor for our CME, which is Southwest College of Naturopathic Medicine. So in states such as the state of Washington and a few others where you need counter signature from a naturopathic institution, we have that for the pharmacology credits as well. And all US states, whether you are an MD, DO, nurse practitioner, or naturopathic doctor, we have you covered for the CME. We also in Canada have CONO approval as well.
Now this is over 3 full days of
Yes.
educational learning. How does that play with the number of hours that you're offering here?
So we have a total of 18 CME being offered, and we have subsets of pharmacology and some ethics as well. And the thing to remember when scheduling is we're a little different from some of the 3-day conferences. Sometimes in those you can start late and end early, so late on Friday, early on Sunday. We start right away early on Friday to get the full amount of credits and time, and we really don't disband until about 4:30 to 5 on Sunday. So one important thing that I've gotten comments from other attendees is they made flights early, assuming we ended at 1 or 2, and we don't really end until 4:30 to 5 on Sunday. So if you're planning and you have a longer trip, maybe take that into account.
So as part of a value add, we offer recordings so they can follow up afterwards and look back at the presentations and have the recordings. But what you're saying is be aware that Sunday is an extended day.
Yes.
And they should not miss out on that.
Very much. And the recordings do a couple of things. One is If you miss something, it's there. You
Right.
have not only the slides, but a recording, and we don't charge extra for that. That's included with your registration.
Mm-hmm.
But the other thing is, a lot of our speakers may either have something in more depth or something new as far as an angle that they are teaching about. And what we find is, because we really pack a lot of educational content into the 18 hours, people will go back and often pick one or two of the sections and listen to them a few times. And with the recordings, you can do that as much as you want.
So for any conference, the exhibitors clearly form a good financial bet for the promoter to cover a lot of the cost. But there are exhibitors and there are exhibitors at these types of conferences. How do you specifically look at these exhibitors in relation to the AMP theme and your views on, on them a little differently to others, I suggest?
Yes, so one of the things I think on the front end that we are very careful with exhibitors, et cetera, is we're very discreet about the dividing lines between CME and non-CME activity.
Right.
So our exhibitors are in their own room, they're not in with the conference, et cetera. But when it comes to the exhibit personnel themselves and the companies, people will ask, well, do you use all of these in your clinic? And of course, I can't use everything. But the way that I look at it is, I am really looking for exhibitors either that I know and I trust, or exhibitors that have either companies, products, labs, etc., that I have looked into and that I would use if I use that type of a lab, for example. So we do vet everybody, and although it may not be all directly people that I would use, there are people that I would use should I need that sort of product or service. So we really do it's not an all-comers sort of exhibitor pool that we use.
Right. So, and there are a few exhibitors that you do hand select to do these interactive workshops that appear popular in the early evening. What's the background to that?
So there's a few types of exhibitors, especially at AAMP, where they may either have a technology or some other type of offering that's a little hard to pick up just at a booth or a discussion quickly in the hallway.
Right.
And what we do on Saturday evening, we provide you with some food and some other good things. We have 4 exhibitors that have real hands-on types of materials, products, etc. Or sometimes it's something where you just have a lot of real deep questions about how does it work, how is it validated, etc. So we have small groups in each room, each of the 4 rooms, and as I said, there's a bit of food and drink for you. And it gives you time to let the exhibitor explain or demonstrate what they do, but also you have the chance to, in a small group, ask as many questions as much in depth as you want. Right. And we do that on Saturday right after we're done with the CME, and we rotate in 30-minute increments. So you get to see everybody during that time. It goes by rather quickly. And what we hear back from people, both the exhibit staff and the attendees, is it gives them some time to have conversations they just can't have any other way.
And you mentioned the food, and one thing that I know comes back from a lot of attendees who come back year on year, they seem particularly excited by the healthy options that AMP provide, an all organic menu, which is rather special and unique. What's your view on the food?
Yes. Well, so one of the things that I've seen in speaking all around really the world, but all around North America, is the food at conferences is highly variable. And one of the things that we set out when we started with AAMP was to have the best quality food, because they are long days, and we're asking a lot of people to be with us for these long days. So we have very full breakfast offerings, lunch offerings, break offerings. Right. But the other thing is that we have options in not just the ability to get organic food, which we work out with our hotels, et cetera, and the catering staff, but we have options for things such as people who are gluten-free. We label everything very carefully, so you know if you can or can't eat it. And it's gotten to the point where the catering and chef staff work so hard, that we now have people sometimes asking us for the recipes that the chefs used.
Right.
So we really try, along with the staff, to get the best quality food for really any conference that I've ever been to.
There's a lot of feedback we get. We have the evaluation forms, and so many attendees believe that the value proposition that we give is significant and way different to many other conferences. The follow-up webinars that you do, that's part of the package, so when they get back they have questions they can follow up. The handouts that you give that you can't share necessarily under the CME forum, that you can provide afterwards. Give a little bit more background to that.
Yeah, kind of along with our drive to have the best quality speakers, but also the best quality food and experience, are these other value adds. So one thing that we do is, once you are at the conference and you've paid your registration, there's nothing that costs anything more. It's all included, including the CME, including all of the other things. Now, in the setting of post-conference, a lot of people had feedback from other conferences where they would hear something really great, get back to their clinic, and it's a month later and maybe they forgot the finer points. What we do is we have 2 post-conference webinars where you can either be on live or you can send your question ahead of time. And we always have a live group with us online, and we record them, so everybody, if you can't make it, it's recorded. And this is specifically to answer questions only for people who've been to AAMP, that particular conference, so that they can ask, they talked about using this type of a protocol. I tried it and this happened. Do you have some feedback? Or I don't remember the finer points of this or that. We can answer those questions because we take the questions ahead of time. We also take live questions, which are quite exciting, and it's all people who heard the same material but maybe had never implemented something. So the webinar really gives you that, and we do 2 of those after each conference. So it's another value. It's a lot like the fact that we give you, as part of your registration, all of the materials, printed and audio files, etc., so you can go back and listen. You also have the chance to ask us questions after the fact.
So there's a lot of added value, and that's clearly one of the reasons why AMP is one of the fastest growing integrative conferences, if not the fastest growing in the US currently. So you have Scottsdale coming up, Dr. Anderson.
Yes.
Are there spaces still available? I know a lot of people who've been signing up. Where are we right now?
So one of the really positive things is, as we're growing, we are experiencing good growth, and we have probably actually a record number of people who have registered for Scottsdale Gastrointestinal Conference ahead of time, but we still have space. We have a really nice setup there. We have a lot of room, but it does have limits. So we have probably double the number of registrants right now that we normally would at this point. So we still have plenty of space, and you can go on the website, aampscottsdale.com, and register directly. Look up you can see the agenda, you can see the speakers, etc. But we do still have space there, and we are filling up much quicker than we have experienced in the past.
Well, I know from a lot of people that signed up, they're very excited about this up and coming conference, both with the agenda, the quality of speakers that you have. So we look forward to joining you in May and putting on another great conference. Thank you, Dr. Anderson.
Thank you.